thank you very much, and congratulations on the Digital University. I'm really looking forward to coming and meeting you all. And I also want to thank the two presentations that just were before, because it's just exciting to see the things that are being developed out of India. And I love TechGensia talking about, you know, working with people who weren't even qualified engineers, but who had the passion to produce the product, and also the focus on low bandwidth. And right brain, of course, that's really exciting. So thank you for having me with you at this important event. And I just wanted to open your imaginations for those of you who are interested in healthcare, because I think with a digital university and people who are thinking about technology and healthcare, and particularly in countries like India, there are immense possibilities, because all healthcare systems all around the world are struggling, and digital is going to have to be one of the solutions that we turn to. So I want to talk to you about some of the things that we're going to see happening in healthcare. Well, I would if I could move my screen, sorry. Oh, okay, there we go. So in healthcare, we've already got the Internet of Things connecting so many things, and we have blockchain, which is already producing projects in payments, provenance, supply chain, identity, and credentialing. And I know Kerala Blockchain Academy is doing a lot of those things. 3D printing is increasingly being used, and was even used to manufacture valves for resuscitators during the COVID pandemic in some countries. Artificial intelligence is connecting with so many technologies, and it's going to make a huge difference in healthcare with automation, streamlining, precision medicine, and epidemic predictions. And mobile technology is the biggest breakthrough that I think gives access to countries like India, where you have large populations who have access to mobile technology now. And indeed, 70% of the world's population now have access to mobile, which just means that you can connect with them in ways that wasn't possible before, and you can connect them to services, you can connect them to the economy, and they can be part of the world that we know. Robotics is going to be big in healthcare with automation of repetitive tasks, and big data, data analytics, data marketplaces, predicting outbreaks, and looking at human and behavioural interactions. This is the future that we're going to be seeing for healthcare. And you will optimise your health and well-being in the palm of your hand, and people can be incentivised to become more involved in their own health and share their own health data with health providers, which allows for optimised and precise healthcare based on the patient. So we're imagining, and I hope you at the Kerala Digital University will be creating some of this, a future where data are captured electronically and flow easily between functions and partners, powering real-time predictive analytics, where we have effective end-to-end data integration, which establishes an authoritative source for all information and links disparate data regardless of source. And this will enable comprehensive searches for subsets of data based on the linkages, which is going to be really important in medical discovery. And smart algorithms will link laboratory and clinical data and create automatic reports that raise red flags about issues of concern. Then artificial intelligence, which I think for healthcare, I've called it the digital Avenger. There are so many ways, and I'll give you some examples of how AI is already being used in healthcare. So stroke, as an example, is a common and frequently occurring condition that affects more than 500 million people. And AI is able to support early disease prediction, diagnosis and treatment, as well as outcomes and prognosis evaluation. In another example, AI can help us pinpoint specific demographics or geographies where population health issues exist, and can help precisely implement education and treatment programs and help reduce spending waste. Expert systems are being used in developing countries, in Brazil to be specific, to predict birth asphyxia in low resource settings. So birth asphyxia is not always predictable or preventable and needs immediate skilled resuscitation. So being able to predict that is going to save lives. AI is also being used in conjunction with other data to predict dengue fever and other disease outbreaks using machine learning and weather data, and identifying epidemics using social media and online news. That means we can be ready for things. And we have a health system that's extremely under challenge today. So we have escalating demand from long-term chronic disease, rising costs, and an aging population and limited resources. This is everywhere. And our traditional healthcare system is around hospitals and doctors. And this works very well for acute episodes of care, but it was never intended to deal with large numbers of people whose conditions are chronic and complex and require longer-term treatment. And also, if you think of the fact that people have access to mobile technology now, you can gain information on your health and your well-being and how to look after your diet, how to manage your diabetes complications using your mobile phone. So this is going to keep people out of hospitals and easier to care for in the home, and easier for people to prevent conditions before they happen and look after their health and wellness. So another phenomenon that we're dealing with, of course, is the data explosion. And the amount of health data, this exponential growth of health data, is expected to reach 10 times by already this year, and even beyond to something called a yottabyte, which I don't even know what it is. But what I know is it's so huge that no human being is going to be able to analyze that data. And yet health data and data in general is going to be one of the most valuable commodities of our time. And 80% is unstructured. So it's only going to be through big data analytics, various types of AI, that we're going to be able to stay current and understand what's going on and be able to use this data to improve the way that we provide healthcare and health information. So we're going to be changing the way our health system works. We're going to be moving from hospital care to out of hospital care, to community care, to personal care, to care in partnership between patients who will own their own data and who will be able to make that available to medical practitioners to have much more precise care. We're going to move from products to solutions. We're going to deliver more intelligent solutions for patients, which is based on precise health data. So we're moving from medical platforms focused on real-time outcome-based care to unimagined precision medicine down to the individual level that can assemble all of the elements of your health data and help predict and prevent disease. This is where the future's going. And I hope at Kerala Digital University, you're going to be building out some of these ideas, and I'd love to work with anyone who is interested. But the big thing is going to be more empowered consumers. People talk about democratisation of healthcare, about empowering the patient, providing the consumers with the data and information they need to proactively manage their own health and wellness and make better informed decisions in partnership with their healthcare providers. One of the huge things, and I raise this because we're in India, where you have some 200 million people who can't read or write. Voice activation is going to be tremendously important for healthcare of illiterate populations. It's going to allow them, using very cheap devices, to gain information, to learn, to communicate, to access social services, to get a mobile wallet to send and receive funds. So the opportunity to be able to reach people who traditionally haven't been able to be reached is going to be immense. with the increasing developments in voice activation and the very cheap devices that are available to them. And I know a number of governments in India have been experimenting with providing cheap devices to poor populations so that they can access information and services. So what we're looking at is the future empowering people to make better choices about their healthcare, guiding treatment choice, where AI can empower clinical decision-making and ensure the right interventions and the treatments are customised to patients, creating personalised care. Where more efficient diagnosis can actually be undertaken by machines, such as routine analysis of scans. Dermatology machines are already more accurate than people, reducing clinician error and enabling early diagnosis. It will allow faster drug development, saving money and time in drug development. Also, mobile apps give people information in their hands on chronic conditions, how to manage their health and wellness, and this is often complemented by wearables. So wearable technology can allow the collection of data about your physical vital signs and can inform people who are looking after you and can inform you when you're at risk of certain conditions. And expert systems can actually even act in the place of doctors using mobile in underserviced areas. And health medical workforce and nursing shortage is going to be one of the critical shortages of our time. So we're going to need technology both for diagnosis, for treatment, and for training. And this is where technology is going to be really critical in ensuring that we can continue to provide healthcare to people and empower people to take greater care of their own health. So I just wanted to introduce you to those ideas. It's going to be transformative, and I believe that the biggest transformations are going to be taking place in emerging economies, in countries like India. It's so exciting to be involved with the Kerala Blockchain Association and now with the Digital University and hear what people are doing, the kinds of developments that you're making, and to really be inspired by Dennis and his team and Right Brain about what's possible. And I want to inspire you to turn your thoughts to healthcare and think about how digital technologies can be used to bring healthcare to the majority of the population of India, where they can participate and be enabled by the developments in technology and mobile. So thank you so much. Incredible congratulations to you for launching the Digital University. I would love to be there with you, but anytime you invite me to come and speak to you and share my ideas and hear from you, you can count on me. So thank you so much.
Thank you, Dr. Jane, for an insightful session. Shall we go for a quick questions session?
Yes, of course.
If anybody have any questions, please ask.
I have a question, Dr. Jane. You talked about, bringing together the data and probably using that data to build epidemiology models and prediction systems and things like that. So one of the problems that we usually face is about the privacy of the patient data, and more so in Europe with the GDPR restrictions. So the question that I have is there any proven cloud-based open data model that governments have adopted across anywhere in the world that we could copy and start collecting data about what is happening in the healthcare system within the state?
Okay, so that's a difficult question. And I have to say to you, before the COVID pandemic, when people would ask me about where blockchain and technology is really going to accelerate, I would never have said the healthcare sector for the very reasons that you're talking about, because it's very sensitive. Patient privacy is incredibly important, but also it's controlled by groups of people who are very reluctant to change. And so technological change and digital change in healthcare, particularly around interoperability and data sharing has been slow to come in healthcare. But also I think the other issue is that there's not necessarily incentives for the people who now own the data, because who owns the data? The hospitals, the insurance companies, the radiology providers, not the patients. And so it's very difficult to convince people to give up and share their data. So the incentives aren't there. But what we have seen during COVID, and I can't answer the question without doing some further checking about what governments are accepting it. But what we've seen is a very rapid acceleration of people getting involved in data sharing, even to the point of that Johns Hopkins map that we used to watch in the beginning of the pandemic, where there were these big red circles that were growing when, the cases were going up. And I think that you'll find that that was underpinned by a blockchain application. And I think what we're seeing in terms of health data and health data markets is that there are a number of both private companies and research organisations that are developing these kinds of platforms for secure data sharing, bearing in mind the issues that you raise around privacy and security. I can't answer the question of the extent to which governments are using it, but it is increasingly being used, and I think we will increasingly see it being used. And I'm happy offline to share with you the companies that are doing that kind of work. In fact, one of them threw open a whole research database for people to use, to try and improve knowledge around COVID during the COVID pandemic. But happy to share what I know about that with you. I think that this will develop, but the other side of it, which I mentioned, is people are working on the idea that patients will own their own data wallet. So all of their healthcare information will be held by them, and they will be able to permission others to use it. And then that will open up this notion that you've probably heard about around data as property and health data as property. So people can actually both permission and make money from their health data. So that's where this is going. I wouldn't say it's yet been effectuated, but people are working on these health data wallets. One project I know quite well is doing it in Kenya at the moment.